My name is Kelsey Colwell, and today my family's on day 63 of our COVID quarantine, which is 9 weeks. We've been in this thing for 9 weeks. Our kids haven't left the house. We've just left for groceries and things like that. 9 weeks in, this all started, with our kids having symptoms that they thought was COVID. It's been a crazy ride. I'll recap some of that in a minute, but yesterday, some of you may have heard in the news this week that there is a small group of kids around the country that are testing positive for COVID antibodies and having Kawasaki disease, like inflammatory symptoms. And Syringa now falls in that category. And so she had another doctor's appointment yesterday. They're concerned that she is among that group, and she was sent for a COVID antibody test yesterday. So it's just been a crazy ride. For Syringa, what that means, if you haven't read some of the articles, just again, I'm going to say it like I've said it a million times, I'm not an expert on any of this, but over the last 9 weeks, Syringa started for about 4 or 5 weeks with all the COVID symptoms. She was diagnosed with pneumonia. They thought essentially she got a really, really nasty, like pneumonia-oriented virus. She was having muscle weakness. We were in and out of the hospital. She couldn't walk some days. Tons of breathing treatments. We were very much struggling to get her care in the middle of everything with COVID, and just struggling to keep her breathing day after day. So that slowly improved some. I'm still going to be honest, we're still doing a lot of breathing interventions still 9 weeks later. But 2.5 weeks ago, and Syringa's still been struggling to sleep, muscle weakness, those kind of things. 2.5 weeks ago, her body broke out in a rash that over 5 days developed into hundreds and hundreds of bumps, many of which were open sores across her body. That rash is still present on her body. We're down to just a handful of really gnarly, kind of inflamed sores. But most of the sores have left deep purple spots all over her body, which I was concerned maybe was going to scar. I talked to the doctor yesterday, and the doctor thinks that the rash was so severe, and we'll see how it progresses, right? This is just what they think for now. The doctor thinks the rash was so severe that it's literally bruised her body, and you can see that. Syringa's skin has hurt for 2.5 weeks now to the touch in general. We've been doing skin treatments every 2, 3, 4 hours. I'm tired. Like, this is just 9 weeks of nuttiness. So we called the pediatrician yesterday. She's been great. She's also been really honest. Like, the antibody test just came out last week. It's Wednesday and they just came out last week. She's also been really honest that the syndrome in children, this thing they're finding, I don't even know if there's a name for it yet, is very new. Syringa got sent for the antibody test yesterday. We have no clue how long it'll take to get that back. The pediatrician was very honest, and she said if she tests positive, we go to disease control and we start figuring out what processes they want to work. She says if it tests negative, it means nothing, because she said the test is so new that they're finding a lot of false negatives. And so we just wait now to see. We started more medications yesterday for Syringa, additional treatments for her skin. She's still struggling with muscle weakness some days, where she's just struggling to even walk up the stairs. Obviously, she's like, we're dressing her in just very loose clothes. She's wearing white t-shirts most of the time. And so it's just, I think in general, and I know this sounds like extreme, but that all shifted for us again yesterday. Our boys are having some pretty significant medical challenges too. We have an 8-year-old boy who's had 2 ear surgeries in the last 2 years, and he had a doctor's appointment this week that the hole in his eardrum has unfortunately actually gotten bigger since the last time they checked it after surgery. And so we're having conversations about how, and he has potentially permanent hearing loss is what we're kind of sitting at right now. So it's just, life is a little crazy for us in the middle of all of this. I think besides the update on Syringa, and I know many of you have been praying for us, thank you. We super appreciate that. We're staying very connected with our pediatrician, so we're gonna get all of our information and all of our answers right from her, and we're really grateful for the role that she's played in our family in the last 9 weeks, for sure. Beyond that, I think I would say, even before we turned full circle and came back to COVID, as far as potential diagnosis in our family yesterday, me personally, I'm just noticing I'm really emotionally exhausted. I feel like many days I've got great mental perspectives, and mentally I'm like, okay, we've got this, we're gonna work this process. But I'm also realizing that 9 weeks in, this thing is just, even on really great weeks, this thing is just exhausting. I'm sure many of you are feeling that. I know I've been talking to many of my friends, via text message or Marco Polo or phone calls or FaceTime calls, and they're also struggling. And I know that the numbers for depression and anxiety and those things are, in countries all over the world, have shown significant increases. And so, I've been asking myself the question too, how do I stay healthy? How do I stay healthy in the middle of all of this? And things I would just really encourage you, whether your life hasn't changed much and you're still feeling overwhelmed and blue, or whether your life has been directly and significantly impacted from COVID, whether that's in a health way or the loss of a family or friend, or financially, that's a gigantic impact. But just make sure that whatever it is, huge impact or not, or somewhere in the middle, this is crazy for everyone. And everyone's probably feeling a certain way. I found myself this week going, I shouldn't be, feeling that emotional about it. We're fine. We personally haven't lost our jobs. We're figuring it out. I need to just suck it up, right? Like, I shouldn't be feeling emotional about this. And my husband's awesome. He's like, I'm not sure suck it up is, I'm like, I probably even use the faith card a little bit. I'm like, I'm just gonna do the right thing and be a good person and suck it up. And my husband's like, I'm not sure that's biblical. I'm not sure suck it up is like the main biblical form here, like for us, because we're always having that faith conversation. And it just reminded me, it's okay to just go, wow, this sucks. It's okay to open up to a friend. I shared with a couple friends this week, like having some really hard days. So don't justify or discount what you're going through based on my life isn't as bad as somebody else's. And don't discount what you're feeling. Find ways to, if it's slowing down and just giving yourselves a space for healthy amounts of sleep. Maybe it's healthy nutrition. Maybe it's a quiet walk outside once a day. I know we're all in different situations. Some of our states are still shut down. Some of our states are still open or starting to open. So whatever it looks like for you. And maybe for you, you have a history of depression or anxiety or those things. And maybe it's time to go see a doctor. And maybe it's time to go that step. Or maybe you're somewhere in the middle. But I just really want to encourage you. I just feel like this is the appropriate post to talk about this. Please take a minute to sit down and do a quick little self-evaluation. If your sleep isn't restful, if you're feeling emotional, even if mentally you're on point, if your emotions, like, I don't know, for me as a girl, sometimes my emotions just make me want to cry when I don't really know why I'm crying all the time, or I'm like, I don't need to be crying. Sometimes that's a cue for me. Whatever it is, like, just pause and take a moment. Like, how are you doing in that area? Again, I've said it in videos before, but as we go back to life, or for those of us who haven't really gone back to any kind of new normal yet. I know in the state of Washington, we're still kind of there. It's just, we don't want to go back with everyone so depleted and so empty that we're just causing a whole nother wave of significant issues. And it's going to be different. And we're not all going to go back chipper and perfect and ready to tackle the world. And that's not at all what I'm saying. But I am saying, how can we try to take care of ourselves during this season? I mean, if this pandemic hasn't taught you already, you really don't have to do the 97 tasks that you do every week. I'm sure there's a few of those that can fall off and life will be just fine. What do you need to do to keep yourself healthy? And it might not make everybody happy, but man, it's going to be so important, especially during this. There are a lot of extra stressors that we don't want to count as stressors, but they are. So that's the update on our daughter. That's my, I don't know, I'd almost call it a plea with you to just take a minute and go, what do I need to do to make sure I'm healthy? And I'm not talking about selfish. I'm just talking about healthy. And I know for me, I can battle back and forth between those things. But we're 9 weeks into this thing. We're 9 weeks into crazy hospital visits with guards. That was one of the weird big moments for me. We're 9 weeks into being denied care when they thought our kid had COVID and we couldn't even get her a chest x-ray. We're 9 weeks into our kids being home. We're 9 weeks into figuring out how do we do school at home while teachers are grappling to figure out how do they do school now when all their kids are at home. We're 9 weeks into figuring out how we all 5 live in this house together 24 hours a day, which has been a kind of a fun and weird journey. We're 9 weeks into getting creative in the middle of this. We're 9 weeks into continually reassessing and reiterating on what does our normal everyday life in this house look like. We're 9 weeks into trying to find toilet paper every few weeks because we were not one of the families that stocked up. We're 9 weeks into kind of evaluating emotionally and stress-wise where are we at. And that is normal life right now for the Colwell family. So I hope you are all doing well as we find out more about Syringa in the coming days and weeks. We'll keep you updated. It'll be interesting to see what they discover about kids who fall in this category.